Welcome to the Diversity Connector podcast, where we explore the rich tapestry of human experiences. I'm your host, Gertrude Mache, and I'd like to acknowledge the traditional custodians of the country on which we meet today. I would also like to pay my respects to elders, past, present, and emerging, and together as we dive into conversations that bridge cultures, challenge stereotypes, and celebrate the unique perspectives each of us brings to the table. Each episode is a journey through stories and insights from a kaleidoscope of voices, each sharing their colorful narrative. Whether you're at home, on the go, or just anywhere in between, you're now part of a community that values understanding, inclusivity, and the beauty of diversity. So plug in your headphones, get comfortable, and let's connect through the power of our shared stories. Welcome, and thank you for joining us on the Diversity Connector podcast. Hello, everybody, and welcome back to the Diversity Connector. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating woman. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, how old you are, and share your story with us today.
Hello, I'm so excited to be here. I am Nik Sweeney, the founder of Imani Nicole Wellness, based in Baltimore, Maryland. We are a holistic wellness spa with an innovative approach to helping women get well. Our concept is a unique, one-of-a-kind fusion of what we call self-care therapy and lifestyle medicine. We have done something simple, something that you would think would be a no-brainer, but we've been able to birth this behavior change intervention by way of the Imani Nicole Wellness Spa. Long story short, we know that when women feel better, they do better. It's an organic process. So stress is the barrier at Imani Nicole Wellness. Not lack of education. It's not about not understanding a healthier food option over another. It's not about not realizing how powerful exercise can be on a regular basis. It's simply put that most women, at least all of our clients, are overwhelmed and stressed out by the day-to-day activities called life. Life is literally lifing for our clients. And as a result of work overload, family overload, caregivers, at the end of the day is exhaustion. And while there is a difference between self-care and self-soothing, so we know that our clients may carve out a little bit of time. They'll get their hair done, they'll get their nails done. They may pause occasionally. Intentionally taking care of ourselves involves a lot more than maintaining a hair or a nail appointment. And that really is why self-care is so important, because self-care is what happens or what we're doing outside of doctor's appointments to maintain good health. So our concept, simply put, takes the stress out of healthy. So how did we come up with this approach, or what's the foundation of it? Well, I am a national board certified health coach, which simply means that the American Medical Association has deemed that I know enough knowledge about behavior change coaching and chronic conditions to be able to empower behavior change. Well, not too long after believing that I was the epitome of health, the role model of health, I was a Zumba instructor as a side hustle as I worked in corporate America. And then eventually begin to take the journey to become a board certified health coach, really digging deeper into behavior change and why do we do what we do or make the changes that we make as it relates to our health. And I found myself in a struggle, my own personal health struggle, that what was natural for me, like waking up and getting excited about exercise, working out 3 to 5 days a week, eating all my broccoli, that I began to see life show up. And this desire to be healthy was no longer second nature. I was not getting enough sleep, not drinking enough water, not even desiring to get up and work out, even though I knew and understood the power of those healthy choices. I had succumbed to stress overload. And so, interestingly, becoming my first client in this concept was just looking also at the statistics, especially the statistics as they relate to women, Black and Brown women, that we're at the top of the charts for diabetes, heart disease, at the top of the charts for death as it relates to these chronic conditions that can be prevented. But what needed to be addressed was not being addressed, and that is stress. We say, wait a minute, now I'm pre diabetic because I ate my way to pre diabetes. That's a whole nother story as well. But I'm not pre diabetic. I have not become diagnosed with pre diabetes because I emotionally ate myself there. We got to dig a little deeper to that. Well, what are the triggers that caused the habits to eventually become diagnosed or at a high risk for a chronic condition? Stress. Manage the stress. Now you're managing your health. So, how do we do it at Imani Nicole Wellness? We're the unplug. Realistically, how often do we unplug? We're on in device overload. So at Imani Nicole Wellness, the unique concept is walking into a place with very little stimulation beyond soothing music, low lights, plant life galore, and these private sauna sessions. We use the amazing benefits of infrared sauna therapy to help women to relax and wind down. When you research infrared sauna heat, you'll find that it helps to stimulate a passive exercise experience for the body, which means it's engaging the heart. It's helping blood flow naturally because it released the endorphins after a 30-minute session. Our clients are refreshed. She feels good. And this feel good feeling is what propels the next step to the change. They want to maintain this state of euphoria in a sense. Now they're ready to make decisions, better decisions about their health. In October 2019, we opened our doors. We are now 4 years in, surviving the pandemic, and we've proven in the 4 years of this concept that not only are we helping women to reduce their stress and manage stress better, but what are the better outcomes and the better results? Well, they are managing blood pressure, they're lowering A1C, they're reducing their risk for type 2 diabetes if they came to us with prediabetes. But I'd love to segue just a minute because not only are we catering to the 40 and over professional women who are looking for an innovative approach to helping them get well, we are a social enterprise with a strong social mission to bridge the health equity gaps for preventative health in under-resourced communities. Those under-resourced communities include African American, Black women, Hispanic, Latino, and women who are deaf and hard of hearing. Our diabetes prevention program is the Center for Disease Control's recognized diabetes prevention program. You'll hear me say DPP. So, the DPP is a lifestyle intervention that helps to reduce the risk of type 2 diabetes, which we know is a very serious chronic illness. Within that program that we launched in June of 2020, we're now 3 years into our DPP, and we're excited because we have now become a full plus recognized prevention program. We are providing this program now to seniors because of our Medicare approval as a supplier. So we're supporting the seniors in their journey to better health without type 2 diabetes. And we're so excited that we are the first and only diabetes prevention program to have launched in the United States for women who are deaf and hard of hearing. So, our diabetes prevention program is facilitated in 3 languages: English, Spanish, and American Sign Language. But what's the hype about a prevention program? Well, we all know that diabetes is a disease that's not talked about enough. It is an epidemic within itself. The sad, harsh realities of type 2 diabetes is that it is an illness that can be prevented with minor lifestyle changes. Unfortunately, it's also one of those illnesses that is at it's just at an all-time high, especially in Black African American communities. Diabetes type 2 can be prevented and it can also be managed, but it is in the state of Maryland the sixth leading cause of death. And so when we talk about type 2 diabetes, it is not uncommon that someone trying to navigate life with type 2 that they're also dealing with other illnesses like hypertension, high cholesterol. And so the big goal here is to work with ones who are at a high risk in those high risk populations and help them to reduce their risk of type 2. So essentially, just to bundle it all up, Imani Nicole Wellness is health innovation. We are looking at stress as the barrier for women, and we're encouraging women to put themselves first and redefine self care as the care needed with intentional efforts or an intentional focus to improve your overall well being with the ultimate goal to reduce their risk, the risk factors of chronic conditions. And then again, we are bridging those health inequity gaps in populations that are at a high risk but lack access to culturally sensitive um, preventative health programs. The diabetes prevention program is both virtual and in person. We have a higher focus, of course, for virtual delivery. The convenience of virtual delivery, as well as the fact that it is proven to be very effective. So, our diabetes prevention program is aiming to increase our reach. We need to expand access to our preventative health programs. The diabetes prevention program is available in most major healthcare systems, but what makes our program unique is our strong focus to support women so that we're able to talk about some of the other health challenges that we face, or some health challenges that are specific to women, and most importantly, stress factors, stress and hormones that impact the decisions that we make on a daily basis as it relates to stress. And again, I'm Nik Sweeney, born and raised in Baltimore, Maryland, on a mission as a social entrepreneur to use my skills, talents, abilities, and energy within the public health space, the public health sector, to create a platform to keep women relevant and to connect with other providers so that we can continue meeting the needs of women in an innovative way to propel positive change.
Wow. Nik, just listening to you speaking is like music to my ears. I went through a very traumatic separation that led to divorce after 27 years of marriage, 31-year relationship. And I ended up collapsing with congestive heart failure from the stress. And, everything you're saying, I wish somebody had told me. It's taken 6 years to get back on my feet and start to almost feel normal again. So thank you for your work and thank you for the inspiration in terms of what you're doing with this business. So, what are the key principles behind the Beautifully Well approach to a healthier life? And how does it differ from traditional healthcare methods?
Oh, love that question. And you are indeed a warrior, Gertrude. Thank you for sharing that. Um, you know, in light of what you've gone through and out the key principles, of course, we know we have to include stress as the barrier. That is the first thing. The first key is reducing stress. But first, acknowledging it, because so often as women on a day-to-day basis, if someone said, "Are you stressed out?" you would probably say no. No, I'm going to work, I'm
Okay.
taking care of the house, I'm taking care of the children. I'm not really stressed out. But
Yes.
stress is number one because we have to identify it because it affects our metabolic system. And that is something that is not the first line of thought in healthcare. Second, we say mindful eating. We don't diet. It Beautifully Well is not about the diet,
Yes.
right? Because that's short term and it doesn't make sense if I'm struggling with food to be given a meal plan with the expectation to just pivot overnight. Third, we say fitness, but our idea of working out is not the gym right away. It's not the personal trainer
Right.
right away because some of us have to work up to that. So our idea of
Yes.
fitness first comes from our passive approach to fitness so that the body still does not have to feel a lag because we're not on a stairmaster 3 days a week. And that last piece is lifestyle coaching. We are behavior change coaching, but our clients have full autonomy. So they are the experts. We're simply the guide with the background in the evidence based philosophies of health and wellness in order to help them take those gradual steps to see change happen.
So, can you share some success stories or testimonials for women who've experienced transformation through your holistic wellness programs?
Can you imagine being diagnosed with prediabetes and 6 months later, your A1C, which is blood glucose levels, have reverted back to normal? Ah! So, our we have to call them patients in the diabetes prevention program because they are patients, but they're beautifuls, right? All of the ladies in a tribe, they are beautifuls. We have a
Yes.
67% pre-diabetes reversal rate in our pre-diabetes program. One story that stands out the most is definitely one of our beautifuls who came to us in the pre-diabetes program, um, with just a history of stress, pre-diabetes, right at that threshold, getting ready to cross over to type 2, but navigating in a 4-month period to get those numbers back. But then let's talk about the spa really briefly. One of our most dedicated beautifuls is now maintaining a 50-pound weight loss. But Gertrude, this 50-pound weight loss is not water weight, number one. Our focus is body fat
Yeah.
reduction. 50 pounds
Hey,
of body fat gone, and a year later, she is still maintaining. So, why I
that's
mention
crazy.
her, 50 pounds is a big deal when it's body fat, right? That actually contours the body. She has gone from a
Yes.
double X to a medium. She looks like a whole nother person. And she did this still eating frozen box
Wow.
pizza. just not as much as when she started, right?
Yes, it's all about quantity and being aware of how much you're consuming, not
The
starving yourself
mindfulness.
from the things that you want to eat. Yes. Mindful eating. Wow. So, you mentioned something that's really pivotal in this whole conversation. Can you share some insights into the importance of diversity and inclusion in the wellness industry and how you promote those values in your own business and in your own nonprofit work?
Excellent question. When we talk about health, you cannot help but have the conversation about access. Who's
Mhm.
benefiting?
Yes.
And for a brief period of time, I was a center director in Jenny Craig. If you're not familiar with Jenny Craig, they are
Very.
similar. Think about Weight Watchers a bit, right? No plugs.
Yes.
But as a center director, I worked with women, 40 to 50 women every week who were willing to spend between $150 to $200 a week just on food alone. They were
Wow.
benefiting from it because they had the ability, they had the finances in order to do it. But
Right.
where were the programs for women who could not? And how do you affect change if you are
Bought
not
that.
willing to dispel, to increase access? So, as I mentioned in that deep dive about what we do, one thing that we noticed, especially with the deaf community, is that the deaf
Mm-hmm.
community is often left out. It requires a lot of effort on the part of healthcare to meet the needs of deaf if you don't have well trained interpreters. If you
Yes.
do not have diversity training in deaf, they're a community. And what we've done in the prevention program, we're proud of, but we're excited of, and we know that we still have some hurdles to get through. But
Mm-hmm.
these programs should be accessible to everyone.
Mm.
And we have designed a program that can support those that have and those who are struggling to maintain. Um, and there's also access to those who are underinsured. And we face that as a barrier, especially with some of our women in the Hispanic Latino community that are underinsured. They are
Right.
here, but how do you meet them where they are? So that is that cliche again, meet you where you are. How do we
Yeah.
do that if
Yeah,
we
That's
don't
that's a
fully
big one.
understand the communities we're serving?
Yes, yes, that's a really big one. Now, I know that in the United States, having lived in Pittsburgh and Albuquerque, New Mexico, and in LA, there are food deserts within the United States, especially in the Black community. Not getting access to grocery stores that are selling fresh produce, for example. People being forced to eat canned food. Talk a little bit to that because that really does impact the health of the majority of people who can't afford to get to a decent supermarket.
Mhm. Yeah, those are the social determinants of health. We hear it so often. Um, I always say access is not access without education. So here I'm in
Mhm.
Baltimore. If you look up Baltimore, we're always making the news, but there are wonderful things happening in Baltimore. And the bad that hits media is literally less than 10% of what's
Mhm.
actually happening. There are a lot of
Yes.
food deserts in Baltimore. And even areas that have supermarkets, we know that the quality of what they're working with cannot
It's
be
not very
compared
good.
to supermarkets in more affluent areas. Well, one of the things that we've done, we call them supermarket
Mm.
tours, where we're able to go into these supermarkets. They may not have the best quality things, but what we're doing, especially in a Black community, we're resilient. We use what we have. We're there
Mm.
educating on the benefits of opting out of those canned goods, or how can you make a canned good healthier, right? Rinse it, get all of that salt, all of those preservatives out of it. Um,
Yes.
there are a lot of food box initiatives, but you're giving me a box of food that's going to go bad in 3 to 4 days. You're not giving me a recipe. What else can
Mm.
I do with the fruit? Or
Yes.
these fresh vegetables, if we're not equipping them or empowering them with the ability to become educated on what's there, then what
Yeah.
good are these campaigns to distribute food boxes?
Yeah. Yeah. Oh, wow. You don't really, people don't think through all of the things that are needed to help somebody get from where they are to where they want to go. Now, your spa experience sounds beautiful, sounds very luxurious. Are you subsidizing for those women who can't afford? Is that why you set up a nonprofit? How does it all work for people who don't have the financial means?
Yep. It's not access if it's not accessible, right? So, our model is interesting. We say for the women who we know have disposable income who can come in and we say this is what it's going to be for the month and they say swipe. It's those purchases, every purchase helps to support what we're doing on the diabetes prevention side. Yes, our nonprofit is there to help us to offset the cost because it's a business and it's still cost. There's still
Mm.
costs associated with it, but we know that this works. And those affected the most by these chronic
Yeah.
conditions and at a higher risk, they need access to wellness that's going to help them reduce the stress. Their stress load is at an all-time high because of their circumstances. So yes, that's what we do. We have a model in place that helps us to offset the cost. We have special incentives and
Mm.
programming in place for women, and we're building more and more community partnerships, especially in the behavioral health space, so that we're able to support their clients with
Right.
what they need in terms of innovative approaches to managing stress and emotional health, emotional wellness.
Wow, there's so many layers to this thing. And do you see light at the end of the tunnel?
Oh, we have been working so hard over the past 4 years to continue to prove our concept, to continue to
Mm.
prove that although we're small in number, we are mighty in force, with
Yeah.
the goal of developing this enough, deep enough, even licensing the concept so that we're able to expand beyond Maryland into other states. And thanks to you in this conversation, the ability to take the concept globally because it works.
Yes.
So it's bigger than me,
Yeah.
Gertrude. I am not here to take over the planet. That's not my job. But I am definitely in a space to be able to equip others who have the same passion and drive for community to be able to implement um, many of the to implement the innovation in other capacities.
So, my last question for you is this. We're going to have a little thought experiment, and I'm going to teleport you into the future. And you're now 80 years old. You're sitting in your rocking chair, surrounded by your children, reflecting back on your life. If you could go and have a conversation with that amazing woman who has led you to this point, what would you say to her based on how you're living your life right now?
I would definitely say resilience is key. I would be so thankful. I'm picturing me at 80 years old though, but still with blonde hair and probably definitely with a pair of high heels on at the same time. Just reflecting on that fact, the hope would be that at that moment I can talk about how many lives have been impacted as a result of this, and not giving up. Because what's interesting about the healthcare system, and you know this too, it is not easy. They don't make it easy with these processes to impact community. So we're talking just a little under 30 years away, 30 years from now, that I can look back and look at how many communities, neighborhoods, states, even countries who have decided to look beyond traditional healthcare and really focus on the needs of the community and
have an
become
impact
community
on.
centered with those approaches.
The other reason why I like to ask that question is that a lot of women don't realize that the wise woman is already in them, that she's already here. She's the one who's guiding you to do this amazing work. And thank you for your work. Thank you so much for coming online today and gracing us with your presence, with your story. This has been absolutely incredible. Like I said, music to my ears to see the work that you're doing.
Amazing. It's been an honor to be here.
Thank you so much. And thank you to everybody who's tuned in today. The Diversity Connector is bringing people from all over the world, sharing stories, knowledge, ideas around diversity, inclusion, and belonging. So come back again tomorrow when I interview yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world. And bye for now. Thanks again, Nik.
Thank you.
And that's a wrap, everybody, on today's episode of the Diversity Connector podcast. Thank you for tuning in and being part of our vibrant and global conversation. I'm your host, Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a tapestry of diverse perspectives. Remember, every story you've heard today is a thread in the larger fabric of our shared humanity. So, as you step back into your world, carry these stories with you and let them inspire you to embrace and celebrate the rich diversity around us. Don't forget to subscribe, rate, and review our podcast to help us share these inspiring stories with more listeners. Do follow us on social media by looking for the Diversity Connector podcast for more updates. Until then, keep connecting, keep listening, and keep celebrating the beauty of diversity. This is the Diversity Connector podcast signing off. Stay curious, stay open,